Now, this week, I met a gentleman called Desmus, and he shared a story about his daughter who suffered stroke because she's a sickler. Now, this, coupled with the many questions from last week, made us feel that it's important for us to come back to this topic and make sure that all your questions are answered. Now, mimi ni Daktari wenyu, Dr. Lauren Mengesa, your host, Daktari wa kina mama. I am based at Akira Care under the Nairobi Hospital. Now, with me today, because of all the requests coming from you, we have back Professor Mwanda. Professor, karibu sana. Thank you for joining us again today. Now, this month is Sickle Cell Awareness Month, and we are doubling down on this topic to make sure that all of us understand clearly what is sickle cell, yani ugonjwa wa selimundu. Tunataka kuelewa ugonjwa huu kwa kina na kimo, ndo maana tumeupatia profesa kwa leo. So welcome, please talk to us on our SMS lines on 22422, call us on numbers down below, and engage us on our socials at ULIZA Daktari and at Daktari_Mengesa. Now, this evening, just before we start, we're going to be listening to a story from Mama Nathaniel on her journey with sickle cell.
I'm a mother of 3, 2 girls and 1 boy. And we'll talk about Nathaniel, my son. Nathaniel was born on 24th of May, 2007. And he got diagnosed with sickle cell anemia 1.5 years later after giving birth to him. How we got to know that Nathaniel had sickle cell is that at one point we had gone for an outing as a family. We had gone for swimming. When we came back home, he was asleep. I was carrying him. I put him down on the sofa. When I put him down on the sofa, he wailed, and I was like, okay, have I put him on a pin, or something? So I pick him up very fast, and I'm like, looking on the sofa, trying to find, is there something that pricked him? I didn't find anything. I was like, okay, maybe there's an ant that has bit him or something. So quickly I unwrap his pampers and all, but there's nothing. But he's still wailing. I called my brother-in-law, who's a medic, and I explained to him. He directed me to a pediatrician. So we went to the pediatrician. He's like, okay, so I'm not sure, but from what I'm seeing, and also his eyes, they're a bit yellow, we could be having sickle cell. Let's just do a test, we'll find out. So we do a test after 2 weeks, we got the results, and we were told he had the sickle cell disease. So he told us we will start on medication. So since he was very young, we were dissolving the medication on a bit of water and giving him. So when we started the medication, Nathaniel was very okay. We grew up very well. Went to school, started school, we went on with life well, there was no issue until we got to class 6. And we started hospital visits, on and off. Then one of the nurses was like, Irene, this is not normal. His blood at 9.8, is there something else? So I was like, oh, Nathaniel is a sickler. They were like, oh, really? Yes. And then the best place to take him is go to Kemri Kilifi. So when we got there, he got his weight. They did again the blood test. And he told us with sickle cell, whenever children start growing, the medication they're taking has to be increased. So we had not known that. So we were still on the half tablets that we started when he was still young, because we were like, it's working. So we calculated, increased the dosage, and we were like, okay, good to go. We went through class 8, he did very well, and we joined high school. So last year he joined Form 3, and we were doing very well. Everything was okay. They closed school for the April holidays. So at one point he calls me, because I was in Mombasa. So he was chatting me and he's telling me, Mom, I'm not feeling too well. I was like, what's happening? He's like, I'm just feeling tired. But at one point, I wasn't really comfortable. So we organized the travel. I come in to Nairobi. So I get there. I look at him. He was so frail. His heart rate was really fast and it's really high. Nathaniel's feet were already becoming cold. So I'm like, okay, let's go take a hot shower just to keep you warm. He's like, no. So I bring for him warm water. He drinks. Then he stands and he says, you just take me back to hospital. Let's just go to hospital. Itaisha, yote itaisha. In fact, that's what he said, yote itaisha. So I asked him, what do you mean when you say yote itaisha? He said, hutanielewa. Nathaniel became very heavy. For me, this is the saddest part in Nathaniel's journey, that I had to handle my son like a sack of potatoes, because I wasn't able to lift him. I wasn't able to carry him in any way, so I had to drag him down. And we were upstairs. So I had to literally drag him down on the stairs. So we get downstairs, and at one point I had him burp. You know, he burped once. Then he burped a second time. And I was just, it hit me, and I was like, no, God, no. Nathaniel cannot live like this. He can't, you know. My daughter is crying, you know. She's like, this is not happening. This cannot happen, you know. He looks at me, then he looks up, and then he just shrugs, and then lets go. So he practically died in my arms. What is interesting with Nathaniel, with sickle cell, is that he didn't look like a sickler, not in any way, you know. We were not prone to hospital visit per se as you would find a sickler, you know. And the amazing thing is that we never at one point ever had a blood transfusion or plasma transfusion. Taking care of a sickler is not easy. Sicklers themselves get to a point they get tired. Nathaniel would throw his drugs. Nathaniel would pour his drugs because he was like, it's too much, I'm tired. But we need to get to a place where we understand them. So I had to get to a place where I had to understand Nathaniel. I wasn't feeling his pain. I would just be empathetic to what he was going through. For us as caregivers is to give love, is to give compassion, is to be empathetic, not sympathetic, empathetic, because we have to also allow them to be able to know their triggers, to be able to know when it's too much for them, to be able to explain how they're feeling, to be able to manage themselves, because even as they grow up, they have to manage this life for themselves. They have to be able to do things for themselves. You can't baby them for long. So you have to allow them to take that step and do that which they need to do for themselves.
Now, our hearts truly go out to Mama Nathaniel and the family. Thank you so much for sharing your story with us. Naam, leo tunazungumzia ugonjwa wa sickle cell anemia ama ugonjwa wa selimundu, ambapo zile seli nyekundu za damu zinabadilisha muundo wake kutoka kule muundo wa duara na kukua ule muundo unaitwa selimundu ama ule muundo wa crescent shape. Hii inaathiri zile tabia ya hizi seli na kufanya hazifanyi kazi vile inastahili. Naam, Professor, maswali ni mengi. I think we'll get right into the questions. So kuna swali hapa anasema, where can one test for sickle cell trait, probably as a premarital precaution? Hii ni swali kutoka Kennedy from Quisero.
Yeah, thank you for the question. It's heavily loaded in many ways. The interesting thing is that we just don't test people. Because that would mean labeling you or labeling another person. And the implications, particularly stigmatization. So one is advised to approach a specialist in that particular area, in this case, sickle cell. Have an honest discussion and allow him or her to make a decision. And this decision is unlikely to be made on first contact. I personally, I don't advise also. Why? Just take note of the description of World Health Organization's status of health. Simply know the absence of disease, but complete physical, social, psychological, spiritual well-being. It is important that we understand the background of the person. The social background, the physical background, the sociological, the spiritual. And mind you, a human being is not an entity. It's a community. It's a family. belongs to some people. These people must be taken into context. I do understand that finally it is you or I. However, the outcome will impact on more than just you alone. So I think we need to take all that in consideration, but I like a conversation. We converse with your doctor. It is good that Kenya is adapting the family doctor concept.
Family medicine.
Yes, it's a slight difference between family medicine and family doctor. You can still have your family doctor who is not a family medicine specialist. And this is a doctor who understands your environment, your family, your psyche, and therefore would communicate with the other doctors who are going to handle you on the reason why the specialist now needs to come in. I think that we should be able to adapt. I know I'm a doctor for several families, directly or indirectly. And I would advise many of us outside there to please do that. Saves a lot, particularly in short terms, the sleep. It saves a lot, yes. As it is, sickle cell is simply not the person who is suffering. It is the entire family, friends, relatives, and more importantly, the future. As you have rightly asked, should I know my status? The simple question is, for what purpose? For who? Yes. It's good to do that, but to appreciate the challenges that lie with that.
Thank you, Professor. Now we have questions on what is the difference between sickle cell and anemia, and does sickle cell come in adulthood or can you only be born with it? This and more will come to you straight after the break. Welcome back. And Eric Enyemili kutoka Hamisi anauliza, tafadhali niuliza daktari kwamba yule mwadhiriwa wa sickle cell anemia ana hatari ya kuishi haswa na umri upi, kwani husemekana wengi wanaozaliwa nayo hawapiti umri wa miaka 12.
Yes, you can live a normal life, normal in the sense just like any other person, because any other person is also likely to get a disease, perhaps worse than sickle cell. Currently, we have about 15% of our sickle cell population well above 25 years of age. I must say, for clarification's sake, when we started the clinic in 1984, 85% of our sickle cell were below the age of 7. We have been able to bring it up, so much so that we have quite a number of them in the teenage. Of course, there is a slight bump in the downwards between the ages of 15 and 25. This is because at that time, they want to be themselves, socially, economically, and they are also building up themselves. And as one of the persons did say here, there is also a level of complacency. I will not be admitted, I will not have transfusion, I will not have crisis, and those can be fatal in some way. To me, it is not so much of sickle cell, but it's the way the individual handles the fact that he or she has sickle cell. I'm afraid to say that sometimes we also take part in that. We go by what they want. For example, they come and they say, "Doctor, I'm supposed to attend a class tomorrow. I need a strong painkiller. And all that I want is painkiller, nothing else." And that's where the problem comes in.
Professor, we have a call and then we come back to you.
Yep.
Okay. Hello, James. Habari ya saa hizi?
Nzuri.
Aha, karibu ULIZA Daktari.
Yeah.
Swali lako?
Hello?
Hello? Hello, tunakusikiza.
Niko Mombasa, nilikuwa ndio hiyo swali kwa sababu naona sasa hivi uko live kwa TV, lakini mtoto wangu alikuwa na hiyo issue. Alafu tukakuja Kenyatta akafundishwa 8 floors for 7C, ndiye alikuwa anatibiwa pale, alafu alikuwa anaongezwa damu inatoka na mapua na alibleed till death. That was 22nd 2022 1st February, and alipata at around 4:30. Hello?
Swali lako?
Swali yangu ni kwa nini akiongezwa damu alikuwa na bleed? Mimi hiyo ndio swali yangu. Maana alikuwa akiongezwa damu, the anaongezwa damu na bleed through the nose. Alafu akableed mpaka akafariki. Sasa sijui kwa nini alikuwa anaongezwa damu inatoka.
Naam, shukran. Okay, Professor, so we can finish. We were talking about the age that we are getting older. Patients with sickle cell, alafu turejee swali. Anauliza alikuwa anapata transfusions but ana bleed. Anapata transfusion and ana bleed. What might have been happening?
The chances are that this may have been a complicated sickle cell case. May I say that the fact that I have sickle cell does not remove me from having any other diseases. Indeed, it becomes very challenging for us as medical people sometimes to tease out the possibility that this person could be having another disease altogether, which may compound the already complicated issues of sickle cell. Having said that, the sickle cell people tend to have easy bruisability or easy bleeding, particularly from the nostrils. This is because the sickle cell affects the smaller blood vessels. And when the sickle cell percolates within the blood vessel, the blood vessel obviously dies. And when it repairs, it will not be as strong as the original one. The slightest sneeze, the slightest disturbance, the slightest fever will cause it to bleed. Another issue is that after the transfusions, they even tend to bleed more. And that is the reason sometimes when we have them, we do not advocate on certain situations. Excuse me if I have to say this. We do not advocate, for example, transfusion and they go home. We do not advocate for transfusion as outpatient. We advocate for transfusion to take longer than the usual people. We advocate for transfusion to be more supervised than other normal people. And if you have to transfuse, there are other things that we need to take into consideration.
We have a call from Naivasha. Hello? Hello, Lillian?
Hello.
Yes, Lillian. Karibu ULIZA Daktari.
Hello.
Hello, swali lako Lillian.
Habari zenu?
Tuko salama.
Nilikuwa nauliza wakati mtoto anaanza kuumia, ako na maumivu ya vingine kidole inavinda. Alafu anaanza kulia, anasema kidole inauma. Alafu vingine unaona macho inakuwa kama yellow hivi.
Naam.
Alafu inakuwa sasa ako na infection. Nini inasababishanga ndio uone anakuwa macho inakuwa yellow ama kidole inavinda, anaanza kulia maumivu.
Swali bora kabisa, na nitaliunganisha na swali lingine hapa. Nasema, Professor, is there a relationship between jaundice and sickle cell? My children after birth 2 to 3 days and then they experience paleness of the body. So yale macho kwa manjano na uchungu ile, anasema what is happening, Professor?
Pain is a cardinal manifestation of sickle cell. And pain of sickle cell starts characteristically from the fingers, from the toes. Whereas the tips may be painful, these other parts start swelling, and that compounds the pain. Yellowness of the eye or jaundice, or rangi ya manjano. Yes, because sickle cell is a fragile cell, it breaks down. When it breaks down into 2 parts, what we call the hemoglobin, which is broken down further, right? And a part which is going to break down in the liver to be changed to the yellow part, what we call bilirubin. So the breakdown will lead to lack of blood or anemia.
Yes.
The other changed, which is going to be bilirubin, will create the yellowness. So these are part and parcel. Yes. So commonly, one will have pain, one will have the anemia, one will then have the yellowness. These 3 are a fair combination to give us a suspicion of anemia. There are other causes which may also just mimic that kind of situation. Yes.
Okay. Now, Professor, there are numerous questions asking tofauti ni nini kati ya leukemia na sickle cell. Alafu kabla hapo tuna simu kutoka Naivasha, kutoka Agnes. Hello.
Hello.
Habari ya Naivasha?
Mzuri sana. Nilikuwa nataka kuuliza daktari hivi. Nilikuwa na dada yangu. Alikuwa na umri wa miaka, by the way she was a warrior, alikuwa na 51 years. She was a sickler.
51?
But 51 years. What happened? Nilikuwa nataka kuuliza daktari, is it really necessary for someone with sickle cell to undergo an operation?
Kama ya bone marrow transplant ama ipi?
No, she had gallstones. So there was a time she was told she had to go on a surgery. So from there, after the surgery, some complication developed. So I wanted to ask that daktari, is it right for a sickle cell person to undergo a surgery?
All right, thank you for your question.
Yes, let's start with that. There are about 4 conditions whereby if a sickle cell person has, we have to take special interest because they require multidisciplinary intervention, consultation, and management, finally. 1 is pregnancy. 2 is surgery. 3 is when somebody experiences what we call stroke. The other is when one experiences what we call chest syndrome. These 3, when one undergoes, needs specialized attention. And the specialized attention will be pegged on 3 things. 1, the blood level must be a certain minimum. 2, the proportion of sickle cell in the individual's level must also be a certain minimum. The oxygen carrying capacity must also be a certain minimum. The level of water in the body must also be a certain minimum. Yes, gallstones are a known complication of sickle cell. And these are the things we watch out for. If indeed one needs to undergo surgery, even an emergency surgery, there is an elaborate preparation before they can undergo surgery. Yes.
Naam, asante. So upasuaji kwa wale ambao wana ugonjwa wa selimundu si kama wengine, lazima watayarishwe kwa njia mufti kabla. Naam, after the break we're going to be looking at what is the difference between sickle cell and anemia, and do we need to remove that spleen when you have sickle cell? Now, our first question is, Professor, tofauti kati ya sickle cell na leukemia ni nini? Kwa kifupi tu.
There's a huge difference between leukemia and sickle cell. One, leukemia is cancer. Leukemia ni saratani ya damu. Na leukemia presents with what we refer to as bone marrow failure. Sickle cell presents only with an aspect of blood, mainly red cells. These others, white cells, platelets, come in as a complication. But in leukemia, all those cells are also affected. If it is acute type of leukemia, all of them, except the abnormal cell, the one which is affected by the leukemia, is increased. The rest are sort of wiped out, reduced. They are reduced in number, they are reduced in function, except the abnormal cells which are increased, but they are abnormal in function. Whereas in sickle cell, it's only red cells which are affected. Functionally, they are okay, except that they are functioning below expectations. The reduction is a complication rather than a direct effect of the sickle cell itself, except in when they percolate. But in leukemia, it's a totally different issue.
Okay. Now, when Mama Nathaniel was speaking to us, she told us about some pills that Nathaniel was taking. Zile alikuwa anavunja kwa nusu. Na hapa tuna swali lingine nasema, hello Professor, kindly help me understand the major pathophysiological mechanism by which sickle cell disease in children leads to both acute crisis and long-term organ damage, and how are modern therapies like hydroxyurea, bone marrow transplantation, and emerging therapies addressing these complications. Tuanzie maybe pale kwa zile dawa wanameza kwa kila siku, then a bit about crisis, what exactly is happening and how are these organs getting damaged.
Yes, the management of sickle cell can be divided into three major categories. The acute phase. And the acute phase is entirely due to the fact that the cell is sickle cell. This sickle cell is fragile. It has a short half-life. It may be as low as 20 days. The normal cell has a half-life of 120 days. So when it breaks down, it gives anemia, what we call hemolytic anemia. And this is what we call lack of blood. And this is what manifests as weakness, lack of energy, heart beating fast, inability to do anything else. The second manifestation is when the sickle cells percolate within the small blood vessels. And that invites other cells also. The first manifestation is pain. The second manifestation is that when it takes long, that particular part of the body may lose its functions, may actually die. And therefore, that's where we have long-term complications. So when a sickle cell person presents, we must identify those, what we call acute phase, and make the diagnosis and handle it. Handling it means giving the right cells, giving oxygen, removing the concentration of the sickle cells, other causing dilution. Then we have what we call prophylactic. As red cells are produced more and more in order to take the issue of reduced cells, right? They require some substrates or substances, particularly folic acid. We take folic acid because it has a shorter half-life, 3 months. Although there are other important substrates such as iron, but iron comes out of when the cells break. So they have an internal replenishment by iron. Vitamin B12, yes, sometimes they may also lack. But the mandatory one is folic acid, which they must have daily. Then for those of them who live in malarial areas, particularly the sickle cell anemia, that is the one who has got double SS.
Yes.
We have to protect them against possibility of malaria. And in that case, we give them a drug, paludrin or something like that, to keep them off the malaria. And then when sickle cell individuals pass 4 years, their spleen, which is supposed to take care of an aspect of infection, specific type of infection, dies functionally, doesn't function. That, therefore, we have to give them drugs to stop them from getting problems that are usually handled by the spleen. And therefore, they will have a minimum of 3 drugs. I personally add another one for the B12 because time has shown me that indeed some of them do have vitamin B12 defect, and indeed other vitamins. So I give them neurobin, which contains some of these other vitamins. Then there is the individual person. As somebody rightly said, people will vary. Let me emphasize the point I made last time.
Yeah.
The fact that somebody has an S or sickle cell is what we call genotypic. But the way they manifest is called phenotypic. These vary in their manifestation. However, 2 members of the same family may manifest the same way, but different families will manifest differently. So it's sometimes not easy to compare one family with another family. And this is what we must take note of. Secondly, and more importantly, an individual with sickle cell should be patronized as an individual, to be understood on what causes any event, particularly crisis. What causes it? And therefore we avoid it. When does it happen? In the morning, in the afternoon, after playing, in the night, and so on. So we patronize it.
Okay.
Then the way people respond will also be different. Obviously, we eat the same food, but we'll respond differently.
True.
In the same way, people will also, with sickle cell, will behave exactly the same way. The message is this: have your doctor who will patronize yours, who will understand yours, who can present your case. However, basic things have to be known. How does a crisis start in one particular individual? What does the individual do initially before they see the doctor? But finally, for our state of medical health, it is important if after taking water, taking a mild painkiller, consult a doctor.
Now, Daktari, is there a reason why crisis sometimes occurs at night? Kuna kitu ambayo inafanya hizi crisis zinatokea kwa wakati mwingine kuliko other times?
Yes, it tends to occur at night because sometimes the oxygen capacity in the particular room where the individual lives may be lower. Maybe there's a high concentration of oxygen. Secondly, when you lie on your back or you lie on your side, the side which is lying down has high acidity. High acidity is likely to instigate sickling, and therefore the crisis may start from there and then spread. So what to do? Make sure you are well hydrated or take a lot of water just before you go to sleep. Make sure your room is well oxygenated or aerated, and there's no high concentration of oxygen. temperature must just be right. When you sweat a lot, you will have crisis. When you are too cold, you will have crisis. And this is exactly the emphasis. Please find out your level. You may not have everybody's level. Any strenuous activity is likely to set it off. In the morning, in the evening after an exercise, when there is lack of water, when there is anything that causes fever, of course fever causes dehydration, which is lack of water. These are the most likely events. Low oxygen, stress of any kind, anything causing dehydration, anything reducing the movement of blood will instigate a crisis. Yes.
Okay, 2 more questions, Professor. There have been a lot of curiosity about this surgery called splenectomy, to remove the spleen. Is there any time where this becomes something that we actually intentionally do as doctors? So Lilingine, hello, Daktari. My sister is a sickle cell patient. She's been having shock and currently having mild, I think it's shock. She was advised to do blood exchange. Is that okay?
The first question, thank God, less than 5% of sickle cell persons would have a big spleen. Out of those persons, very few would have a spleen which causes problems. The spleen also has position problems. In that case, doctors working as a team can plan to do what we call splenectomy removal. However, we don't advise the removal of spleen before the age of 4. Unless extremely necessary, we may not remove the spleen between the age of 4 and 7. We are at liberty with good preparation to remove the spleen. However, we must make sure that the other organs, particularly the liver, particularly the heart, particularly the lung, are in good shape, because these will likely to lead to serious complications. In that tone, again, we advise that sickle cell patients be immunized, be vaccinated against certain organisms. And what delays doing splenectomy is that we have to make sure that they are properly immunized against these infections, because they'll suffer the same fate as the people whose spleens are not functioning, sometimes even worse. There are other issues why we do not advise. One, when the spleen is removed, the white cells react, the platelets react, and these may, in fact, compound the crisis, which sometimes may be catastrophic. Therefore, that brings me to the very important aspect. Just we don't look at the hemoglobin level alone. Look at the white cells, look at the platelets, because whatever you do, they will also be affected and they will also cause effect. In fact, people who have high platelets, high white cells, have severe obstruction of their microvascular systems than those who do not. And once you remove the spleen,
problems,
they'll come up. But under good medical direction, multidisciplinary approach,
it can be
removed.
Professor, time is never enough when it's with you. Your lessons are quite informative. Thank you once again for honoring our invite. Thank you for joining us. Thank you again, Mama Nathaniel, for sharing your story, and for all the other sickle cell warriors who have joined us and shared their journeys with us. Again, this has been Sickle Cell Awareness Month, and we hope that you have learned something. Please tell a friend to tell a friend, and let's keep learning and teaching. Until next week on Sunday at 8 p.m., join us on ULIZA Daktari.